Good evening, everybody. You are very, very welcome to this moment of In Conversation with Sinn Féin. My name is Louise O'Reilly. I'm a TD for the Dublin Fingal area, and I'm also the party spokesperson in the Dáil on Health. I am really, really pleased and delighted to be joined this evening by Dr. Gabreille Colleran. We'll be taking your questions on COVID-19 and the health service over the next 20 to 30 minutes or so. Dr. Colleran is a consultant paediatric radiologist at the Children's University Hospital in Temple Street. She's also a consultant radiologist in the National Maternity Hospital, and she's head of radiology at the NMH as well. Gabreille is also Vice President of the Irish Hospital Consultants Association. So it's safe enough to say that Gabreille is an extremely busy woman. So I just want to say at the very, very outset, we absolutely appreciate the time that you are giving to us this evening. I want to start by not just thanking Dr. Colleran for her time, but also to express our gratitude to all of the healthcare workers. And as I've been saying for a while now, there's no reserves in this. Everyone is a first team player. Everyone is on the front line in our healthcare services, and we commend you, we salute you, and we are doing all that we can to ensure that you're in the best position to fight this. So before we take questions, and there have been many questions, we've done our best to try to collate the questions so that we can get as many of them answered as possible this evening. But I want to start by asking Gabreille if she can give us an insight into what it is like. How do you balance your time? How do you manage family, work with the additional pressures? Because we know the health service was already under a lot of pressure. Now we have the additional pressure of COVID-19. How are you coping with all of that?
I guess, Louise, it's fair to say that like our daily lives now are almost unrecognisable from 6-7 weeks ago. And there's still times when I wake up in the morning and I kind of hope it might just be a bad dream and I'll just have a normal day. But you kind of know that there's too much detail and it's not a dream. So normally my alarm goes off at 5:45 because before this I would have worked out in the gym before work. But obviously the gym is closed and I couldn't go anyways with social distancing before they closed. So now my alarm goes off at 6:15, and the first thing the two of us do, because himself is a consultant as well, is we check our temperatures. Because Beaumont have now brought this in, just checking the temp just to see if we've any signs of infection that mean we shouldn't go to work. And thankfully so far the two of us have been grand, so that's sort of a bit different. And then I make my breakfast, and what's different is I now pack all my food for work because I'm trying to social work, so I'm not going to the canteen. And anyone who works in Temple Street watching this will know that like Nora MacDonald is basically a mammy to all of us in Temple Street. And it's funny the things you miss. I actually really miss going down to the canteen at lunch and having the bit of banter and the chat and seeing what's on and, picking between the fish and chips and the healthy option and all that kind of stuff. And then my childminder is amazing. And so she arrives at 7 o'clock as normal. And then the next change is that I would normally get the bus and do emails for work on the bus. But similar, early on about 5 weeks ago, my husband said to me, look, you shouldn't be getting the bus now. Like in China, they stopped healthcare workers getting the bus in terms of transmission. And he said, you need to get back on the bike. So I used to cycle to work before I had kids. And to be honest, I just lost my nerve. I was one of the first at the scene of a fatal bike accident, and it just hit me. And the combination of that and having small kids, I just didn't feel up to doing the Dublin commuting things. You're kind of taking your life in your hands, like you have a bike lane and then it disappears. And but I said, right, okay, I got to just feel the fear and do it anyways. And that's been one of the few things that's been pleasant actually, is I'm now cycling to work, and I'm really because I would normally I love the exercise, I love lifting weights, and I love the banter in the gym. I'm really missing that. Getting on the bike and the fresh air and feeling the breeze and the bit of an endorphin rush as well from the bit of speed on the way. So I'm a radiologist, so a good chunk of my work is around multidisciplinary meetings. So for people to be where things like our cancer patients or our patients who have abnormalities on their anatomy scans, we have meetings where we discuss everything, go through it, make a plan for them. And normally you might have 40, 50 people from the interdisciplinary team together in the one room. We can't do that now. So now we're doing all those meetings by Zoom and by GoToMeeting. And at the hospital, like in Hall Street, where I do one of those meetings every week, have been really efficient at like switching that, and the technology has worked really well. So clinically, those meetings are working really well. But what it has brought home to me is how much as healthcare workers, we get a lot of support from each other just in meeting each other and a bit of social chat at the start or the end of a meeting. And now all that's gone because we're all in our individual areas by ourselves. So it's quite isolating, you know. And then I guess there's so much work going on through the day around the pathways for patients with COVID-19 and managing that. But then we're also doing a lot of work around our other patients. So say, like my subspecialty area is fetal MRI. So women who have an abnormality on their anatomy scan, you know, a certain number of those women will come to me for an MRI scan for more complementary information. And so pregnancies are still, you know, happening as normal. None of that can wait. And we still want them to have, you know, the same high standard of care that they would at any time. So we're having to change our practice. Like before, being super efficient, we'd have, you know, one patient coming off the MRI scanner and the other patient ready to go. But now we're spacing out the appointments so that they don't meet each other in the department. So again, you know, we're taking all these extra precautions just to try and keep people safe and reduce transmission. But one of the things that stays with me, Louise, is like if we look at the Ebola outbreaks, and there's loads of data on this, the non-Ebola mortality goes up fourfold during and after Ebola outbreaks. It's like, you know, the impact of the pandemic and the epidemic. So we really want to prevent that for our patients. So where media attention is focused on COVID and COVID pathways, and that's hugely important. All the other work, like, you know, you and I had a lot of conversations about the important critical issues in health 6 months ago before any of this. So all those issues are still there now. So there's a lot of work then around that. So the days are jam packed, but they're a lot more isolating than before. And at a time like this, where, you know, like a few of my friends have COVID now. One of my colleagues who I worked with in Galway is now very sick with it. That's hard, like on a personal, emotional level, because you have to try and park that and still focus on doing the job.
But you still have to, I think that's the key. You still have to, the message needs to be sent out to people as well, very clearly. The health service is still open and functioning. I mean, if you're unwell, the health service is still there for you. But it is now made more complicated to manage that, because you're not only preparing for a surge, but you're also trying to deal with the complications arising from COVID. But I think it's really important that we say to people as well, the health service is open, and, you know, not just in the National Maternity Hospital, because obviously that's just going to happen. You can't schedule that, and if ever a consultant or anybody else can figure out how to do that, well, you know, they'll be a millionaire. But I think the important thing to say to people is the health service is open. People are still working. They're just working in a different way now, you know. And I'm very struck by what you said about the isolation, because I would have worked previously as a union organiser representing people, and one of the things that they always had was that camaraderie, that backup, and, you know, that sort of that sense of collectivity. Even when the nurses were on the picket line, the consultants, the cleaners, the HCAs, the porters, everybody was out with them. It was a very much a collective experience, and it's worrying to know how, you know, our frontline healthcare workers are going to be able to cope without the backup and just the everyday interactions, you know, as we prepare for this surge.
Because we have to try and socially distance from each other so we don't spread it to each other. And that sort of goes against our natural human thing, is to, you know, give someone a hug, like lean in, have a cup of tea, have a chat. So we're having to find new ways to do that. And like myself and my colleagues in Temp Street, like we did a little Zoom meeting Sunday night where we had like juice, tea, wine, and an hour of a chat, just that bit of social connection, because we were all just like missing that support that we get from that we didn't even realize was support, you know. And then I guess the other difference is when I arrive home now, I park the bike in the garage, put all the clothes into the washing machine, upstairs and shower, and I don't go near the kids until I'm like, I've had the shower. So it's very different. And then you're trying to switch off. So like I have a child in school and I have a toddler, and the toddler hasn't really much notice of it. But my older one who's in school, my life choices that all the other mannies in her class are working from home.
All off working.
And, you know, so she was like, why didn't you pick the job where you could be at home now instead of the choice that you made? But hopefully one day she'll be proud of me. But she's really missing her little friends, and she's really struggling with it. And, you know, I've tried to tell her as little as possible, not wanting to sort of provoke anxiety, and just tell her, oh, this, you know, it's a bit of a rambling germ, and we're staying home so we don't spread it to people, and everything will go back to normal in a while. But they take in an awful lot, and, you know, they pick up snippets from the TV and that. So, and she's really, really missing normal life and the little friends and that. So trying then to to balance that and put a little bit of fun in her evening, and then it's sort of trying to get to bed and start all over again,
Yeah, and it is so much tougher. I mean, you and I have discussed many times the crisis in the health service, the fact that realistically speaking, we were not in a good shape going into this. We've great people working in the health service, but the fact that as we headed into this pandemic, we were short-staffed, we were short of ICU beds. I think the effort that frontline healthcare workers have made, not just to keep the show on the road, but also to get the show ready for what's coming, in the next couple of weeks. I've been blown away by that effort, and I know from the comments that are coming in when we announced we were having this going to have this in conversation, there was a huge number of people, obviously swamped in admiration for yourselves and everything that you guys are doing, but also, some of the things that are concerning people, the very high rate among our healthcare workers of infection, and that does seem to be a little bit out of line with other countries, and that's really worrying people, because I mean, at the end of the day, you guys are our best defence. Well, staying at home actually and not leaving is our best defence, but failing that, it's here.
Yeah, we're the last line of defence. Yeah.
Yes, you are our last line. Our first line is stay at home, wash hands. We know that, and hopefully more people are doing that. But the virus is here, and as we're dealing with it, I think it's kind of important that people understand that we did not come into this in good shape, but through the efforts of our frontline healthcare workers, we are getting ourselves into good shape.
Yeah. I think that was probably one of the things that some of us found really frustrating was that the prospectus report, which was a really good HSE report, it really outlined very well back in 2009 what we had to do to get our ICU capacity up to European average. And so it was quite shocking that in 2020 we had less ICU beds than we had in 2009, when a more than doubling was recommended. Mm-hmm. It's a credit to the staff and to everyone at every level, the amount of work that has gone into creating additional ICU capacity, sourcing ventilators, but again, when it comes back to, baseline, and it comes back to lessons and going forward, ICU is so much more than ventilators. It is skilled, trained ICU nurses. It is skilled, trained ICU consultants. It is everything around that network. And what I hope is that after this, there'll be one of the things that people sort of thought about our health service was that it was intractable, the problems, that we couldn't fix it. And so when I would say, we can totally fix this, we can go from being the worst in Europe to the best in Europe in 5 years. People used to say to me, look, you're on a hiding to nothing, just focus on your own area, you can do a really good job in that, but like the bigger picture, it's too far gone, there's no saving it. And what we've seen in the response to COVID-19 is that actually when politicians, Department of Health, HSE, frontline workers are all united and really actively making a decision that we're just going to make this happen, can actually happen really quickly, and work practices can be actually directed at things when we decide their priorities. So what I would hope is that the energy that's going into COVID-19 now, all those people who are waiting on lists for hip replacement and for cataracts, children waiting for early intervention, we need to tackle that with the same sense of urgency and importance that we are COVID-19, so that at the end of this, we have a health system. Like my dream, and the thing that came back with me from Boston, was this idea that I would be working in a system where everybody has access to everything within 6 weeks. And people said to me, I was crazy to think that it could be doable, but it's actually, this is just,
it's happening now.
Totally doable.
And I think the things that we've seen, I mean, certainly it's something that I've been saying, and you and I've talked many times, is, the biggest con ever pulled on the Irish people was to make them believe that the health service was broken beyond repair. We see it now in all of its glory, and everyone in behind it. I'm conscious now that we have some questions come in. So what we did is we tried to select the questions that are most representative of the issues that people are raising. So people want to know how more people, how more organisations, and indeed the government can help. Justina sent us in a question. She says, I'm a healthcare assistant and I feel we're not being looked after properly by regard to PPE. I dread the next few weeks. I've been advised that we are compliant with all of the guidelines, so I'd like a discussion around PPE. Thank you. Claire in Kenmare says she's on day 13 waiting on test results. She has 2 young kids at home, one with autism, who is distressed because he can't get the hugs that he needs for reassurance. She's called her doctor, she's called the HSE, but nobody seems able to help her. And Brian asks, he says he's concerned about people putting off seeing the doctor for issues that are not related to COVID. People are worried about putting pressure on the health service, but they're also worried about leaving the house. And he's asking, maybe Dr. Colleran, if you could address that. So I suppose the first one is in relation to PPE. Huge amount of discussion about it. Sinn Féin and myself and others have been saying we need to have this domestically produced, because that's the only way we can be assured that we have a secure supply of it, because we came into this not in the best shape in terms of staff or indeed in terms of resources. So over to yourself.
So it's a great question. My perspective on this would be that in the setting of a global pandemic, all the external sources that we're looking to for PPE will have other countries, most of whom are bigger, putting in bigger orders. So it makes sense for us to diversify our sources as much as possible. So great that we have this trade line with China and this link. But personally, I think there's a massive opportunity for us. We've got a really skilled workforce here in Ireland for the IDA and for native companies to redirect their production towards producing PPE. And it has the double benefit that we're not waiting on imports. It's locally produced. And once we know what they're producing, we can try and scale it up as much as possible to meet our needs. And also then, put out orders to China, put out orders to other countries. But creating jobs in our own country at a time when there are huge job losses, and also the security of the fact that it's locally produced. To me, it's a no-brainer. Like our clinical director in Holles Street, he put out a tweet last week about making visors and looking for links with Irish companies. Within a few hours, he had a link with a company in the north, and they're now supplying us with a couple of thousand visors per week. So we need more of that, and we need it upscaled. And I think I would totally identify with what Justina says, because as a frontline worker, when people ask me what they can do, and they're talking about pizza and coffee and all these things, and I would say, I'm still getting paid my salary. I can pay for my coffee, I can pay for my pizza. There's loads of families that are out of work that have lost jobs. They need financial help. I don't. What I need to know is that when I'm going into a patient who has COVID-19 or suspected of COVID-19, when I reach up to the press to get out my gloves and my mask and my apron or whatever else I need to know that it's there and that it's the appropriate quality. I will say, in terms of reassurance, Martin Cormacan, who's the lead for the HSE on hospital-acquired infection and over the PPE that we're using, he was my prof when I did micro in college, and he's one of the most intelligent, but also such integrity and such kindness and just so clever, and I would really trust him. So I admire that at the weekend, we all knew that we'd heard the rumours about there being issues with the first delivery of PPE that came from China. And I think the fact that Martin and Colm Henry, brought the media out to the warehouse and said, look, there's an issue with this percentage, a certain percentage we can't use, a certain percentage we can repurpose. That makes me as a frontline healthcare worker feel much more comfortable, because I feel that if they're going to be honest about the difficulties, then I can trust that faulty equipment isn't going to reach me. But I would say one thing I did find annoying was earlier in this, a couple of weeks back, people were saying things like, we have put in 20 years worth of a PPE order. 20 years worth of PPE outside of a setting of a pandemic is irrelevant. How much does it convert to in terms of days or weeks when we have X percentage of the population infected with COVID and X percentage in our hospitals? So that wasn't helpful, but thankfully that narrative has shifted. But I think I would share Justina's worry in that, will we have enough PPE throughout this pandemic? Because it's going to go on for months, and looking at some of the other European countries that are so badly affected, we are competing in a global market for PPE. So it absolutely makes sense to be ramping up our home production, and it's providing jobs at a time when our country is really vulnerable.
That one's a bit of a no-brainer. Okay. It is. It's one of those things that we really should be doing. But also then we have the capacity for quality control, so that we can make sure that it's getting to where it needs to, so that we're not waiting on a flight or a container or whatever it is, that we can say it's being produced here. We can be in the fact that it's getting. And I think every single person, and you can see it through the comments that we got, people are just saying all we want is to know that our frontline healthcare workers are going to be safe, that they have the equipment that they need. And you're right in what you say, and people want to do something. They want to help. That's why the pizzas are coming from. That's why people want to do what they can. And I suppose that's back to but I'll just go back to Claire's question there. Day 13, waiting on test results. She's very anxious. She has a son with autism, and he is extremely distressed. I think there's a lot of that.
Yeah, so, firstly to say that's just on a personal level, that's hugely distressing for any parent. But you add into a situation where you have a child with additional needs who really needs the support at this time that is even more challenging because all our routines are off. That is very hard. I guess what I have to say, and I know it mightn't necessarily be easy for people, in terms of our response to this and the testing. Once people have symptoms of COVID, we need everybody to be isolating and staying in self-isolation to reduce the spread. And we know that 80% of people will be well enough to stay at home. And it's I haven't got all Claire's information there, but it sounds like she has been able to stay at home and hasn't needed to go to hospital. So although, of course, it would be much better for Claire to have a result and know the answer, in terms of stopping Claire isn't going out, it's not spreading the virus. Now, her interaction with her son is being impaired, so that's a huge thing. And so I would much prefer to have a result. But at a population level, looking at how we've ramped up testing, we really need the testing to be most focused on healthcare workers being able to stay at work, because we've had a lot of people out, and that impacts the service and the quality of care we can provide to patients. And we need it in hospital to help us with triaging patients into the COVID and non-COVID pathways. I think that when we get the antibody testing and when that's more widespread, we'll get more of a feel for who's immune and who isn't. And we still don't have it once. Are you actually immune, or could you get it again? And could you get it more severe again or not? So we're still learning so much. To be fair, we're our medical scientists have just been phenomenal. And, we have ramped up, we're testing, I think it's 8 times what the UK is testing. It was 7 point something fold. So we're doing very well on a population level. But there are stories like Claire's that, of course, break your heart on an individual level. And we're striving to do better on it. But the reality is that this test, we weren't able to do it in January. And we have ramped it up so well that overall it's been a success. But of course, there are individuals like that where you go, God, I wish we could have done better.
I think there are a cause of concern for people purely and simply because they, people have to, if you have to take time off work for, because you're isolating, you can find yourself in a situation whereby you go back out into the community, then you might have to take more time off work. I think it's that is that's worrying people. And as well, in the very beginning of this, the people that we looked to for guidance said, we're going to test, trace and isolate. And I think when so many people were referred for testing, the wait is just it's so distressing. I mean, it's something that we're dealing with in our constituency offices, are just so distressed waiting on the result because they think, if I have it, I don't. And I appreciate the advice if you have it, but I think it's the peace of mind issue. It's the up at night, and also in the case of Claire, it's not being able to hug her son, and it's that distress. It's the same as, and we've talked about waiting lists many times, but every waiting list is made up of individuals who are struggling at home. And I think for them, what we really need is something definitive, either a message from the doctor to say it's okay, hug your son, just do that, or not knowing, and it's the not knowing that is causing that distress. And really, as I said, myself and Darren O'Rourke made a proposal to government last week about sourcing the reagent, the tools necessary to do the testing here on the island, so that we can be assured of that supply, because it is going to be in huge demand. And the antibody testing will be fantastic, but it's the it's the here and now. It's those people waiting. It's the distress that they have, and I think that's something.
The other thing, Louise, is that we do know that if people are self-isolating and they're waiting for a test, people do better self-isolating when they definitively know they're positive. If they're waiting on a result but don't have it, there's maybe slightly more tempted to go to the shop themselves instead of getting someone else to do it for them, because they don't want to put people out first. When they know they're positive, they really know they don't want their elderly neighbour,
that's the danger,
or their friend with CF. So people are better at when they know for sure. So definitely, we would be aiming to get those results out as quick as possible. But it's been a real challenge. And I think it was the criteria changed, and then there was a huge surge in demand. And it was just, like you said, because of the reagent shortages. And again, one of the things that's been amazing is, one of the reagents, the universities have stepped up and are providing it now, which is amazing. Yeah. But one of the issues is that the mechanism for extracting the RNA, that test is patented. So you're dependent on a certain number of companies being able to ramp up their production fast.
Okay, well, you're also dependent on the government to go in and say, remember them laws that protect you? They don't anymore. But look, that's an argument for another day. Brian's question here about he's concerned about people putting out. What's your message to those people? And also just what can people do?
So the first thing I'd say is, in terms of first dealing with like the serious urgent things, if tonight people are watching this and they're having serious symptoms, things like symptoms of a heart attack, symptoms of a stroke, symptoms of bowel obstruction, severe leg pain that could be, a clot in the legs, these kind of serious things, loss of vision. If you would have gone to A&E with these symptoms 6 months ago, please go again now. Now, I'm not going to pretend to people that going to hospital is free at the moment, because we do have, COVID in the hospitals. But we are doing everything we can to try and protect people that come into the hospitals that don't have it from getting it. I can't promise people they won't get it in hospitals, because we know that, COVID can be transmitted between patients and also between healthcare workers or healthcare worker patients. We're doing everything we can to try. But if you have serious symptoms, like what we don't want is, like I was saying earlier, Louise, that 4-fold increase in mortality. Things like heart attack, stroke, bowel obstruction. Yeah. So please still come.
So people should still be turning up. Yeah. I'm conscious of time now, and I know we have in terms of questions. Sorry, go on.
In terms of the less urgent things, but still important, like people feeling a lump in the breast, or maybe having like vaginal bleeding, things that could be symptoms of breast cancer, cervical cancer, all those things. That's where contacting your GP over the phone. And, if you might have some symptoms of COVID and some symptoms of something else, a video consultation might be possible. Like our GPs, they're often underappreciated, but the blind on this in the way they are really innovating and working around it and really trying to meet need. So, and if you don't have symptoms of COVID, it might well be possible for you to schedule an appointment with your GP that's done in a way, again, minimizing the risk of COVID, avoid you having complications from not going. So what I'd say to people is, whether it is, the nurse in the practice, the GP, the doctor in the hospital, we really have two things in mind: really trying to get as many people through COVID as possible, but also really trying to minimize the impact on the health of the nation with people with other conditions. So please reach out to us. Don't be worrying at home. Pick up the phone.
That's a really important message for people to hear. So I'm going to move on. So Roisin has texted in. She said, I support the nurses and the healthcare workers when they went on strike last year. And I think the work that the doctors and everyone on the front line is doing is absolutely fantastic and selfless. I always thought our government never really appreciated the work done in the health service, which is always under huge pressure. Will this change now? Eugene also talks about there are 5,000 extra beds in the system. How can we ensure that we keep these beds? Paul says he believes that the crisis has shown how important it is to join up the two healths on our island. So just your thoughts on those questions. So they're varied, but they're fairly similar in their themes. So it's a post-COVID. What can we hope
for? So I think the first thing is that in terms of post-COVID, our COVID response has to include how we are planning to deal with all the patients who aren't being seen now because of COVID. So if we tackle COVID and we don't tackle the impact on the patients who are waiting for care now for, serious things, cataracts, hip replacement, things that have a huge impact on people's quality of life, so it has to be an integrated approach. And then there's that broader question then about our healthcare system and how we provide care and what access we think people should have. I feel very strongly, you and I have had this conversation, Louise, that nobody should wait longer than 6 weeks for anything. It should be designed around our population. And for that to happen, there's a huge amount of investment that has to happen, my little helpers.
Hello.
We're live now, you can't say that.
It is.
So where was I? So I really think, we have to have that focus on now saying, right, life will never be the same after COVID. So let's make sure it's a better new. And all bets are off in terms of what we can or cannot do. And so the focus should be on redesigning the system so that it really works for people. And for me, a system where everyone is seen within 6 weeks is a system that really works for people. And so now that we've shown that we can really be flexible and innovate in response to this, there's no reason we can't apply that. But there has to be will. And I do have worries about the finances for it, Louise, because there's a huge amount of work that needs to happen and a huge amount of investment to do that. And so I really want to see the country, and I know you and I have talked about this offline before, that if we're to get everybody back to work, if we're to get kids back into school, if we're to get ahead of this, we have to learn from the societies that have done it really well. So South Korea, Singapore, they had the advantage of having the experience with SARS and MERS. So they've really used the technology to get ahead of it. So the government at the moment, and the app is based on Bluetooth. And what it's going to do is, if you and I, instead of having this by Skype, if we were in your house chatting for 2 or 3 hours, and if in a week's time you had a positive test for coronavirus, or when it would contact you, at the moment it's manually, and they'd ask you everybody you had significant contact with. But if you had downloaded the app, and then at the point that your test was positive, they would say, Louise, have we your permission to get that data from you so we can, use the tech to trace your contacts? I then get a text message saying you have been in contact with someone with coronavirus, self-isolate, and we're going to test you. That's how we get ahead of the clusters and how we shut it down and get ahead of the virus. There are huge concerns around privacy, and how to ensure that the data isn't used for other things, especially like criminal investigations. And we have to get that bit right, because for me as a doctor, unless 40% of the population download it, it won't make enough of a difference to really impact. And so we have to get privacy bit right.
The trust element is huge, and I think that's why those who are developing it, they need to be absolutely upfront and honest from the very, very beginning, and they need to be very, very clear with people. We need independent assessment. We need to have that independent oversight, and that's really, really important. We know that things are going to be different post-COVID. The question is, can we be assured that our privacy will be protected? And if the answer to that is yes, well, then I think you're going to find, that if the answer to that is yes, I think you're going to find that people know, but they will want to know that their privacy is going to be respected. But just in terms of the beds, we got a lot of questions in about how things are going to be different. But there's extra beds, and we want to see those beds kept. The beds that could never be found are there now. Happy days. Well, let's ensure that we can keep as many of them as we possibly can in the system, so that we don't end up when we have to, when we face this again. And the other thing, and the other question that was raised there around the all-island health service. So we've a memorandum of understanding signed today. Really, really important document. Cooperation, north and south, maximising the benefits of being a small island. But we should look at merging the health service. It's very expensive to operate 2 health systems on a small island. Would you have a view on that, in terms of not the political view, but from the health view?
In the IHCA, we've been saying for quite a few years now that we need to have 2,500 more beds in the system. So, like the current situation where we now have 5,000 more beds, we should be looking to see how many of those that we can keep. And again, I don't know the ins and outs of the finances of various private hospitals, but I know that there are some of them who are very profitable and some of them operating at a loss. So surely some of them operating at a loss might be very happy to sell us those beds, in which case, there's ready-made capacity there. And what I'd love to see is, some of them becoming elective hospitals, so that we could guarantee and ensure that some of those people waiting on lists could actually be just going into those elective hospitals, and you can run them really efficiently. And if we look at our neighbours in Scotland, they have a really good model of using the elective hospitals like that, and that really works for patients. So I think things that work for patients tend to work for healthcare workers, because when the patients are getting a good service, it goes with it that the staff are being looked after properly and treated well and respected, because that's how it works. If it works for patients, it works for doctors. In terms of All Ireland, to me, that's a no-brainer. Like in reality, what we should be doing is looking at the country as a whole. We already see that there's a lot of cross-border cooperation. So I work in Children's Health Ireland in one aspect of my job, and the cardiology services between north and south are very integrated, and between Dublin, and I see that as well with cancer services. So there's lots of areas where we're already integrating. But really, what we should be doing is looking at the island as a whole, looking at our demographics, looking at the projected needs, and then looking at how do we best provide services so that we can provide them as close to possible to home for people, the right person, right place, right time. And really to, keeping the patient at the centre, because, I'm a doctor, all of my colleagues, none of us would have jobs if it wasn't for patients. And I think sometimes when we design services, we design the services around what works for the system instead of looking at the patient and them what works for them and designing the system around their needs. And it's especially something, I mean, I'm sort of straying off topic a little bit, when we look at, homelessness and the intersection between homelessness and health inequality, and, lots of things around are inaccessible if you're homeless or if you have difficulty reading. There's a huge amount of challenges for people to access the health system. So one of my colleagues in James's, Keenan Kelly, she's an infectious disease consultant, but she does a huge amount around inclusion in healthcare and how do we, bring healthcare to people who otherwise can't access it because of them. So I think some of it for us in healthcare is actually a shift in our mindset, that instead of designing the system, the service around the system needs, we design the patient needs, and that's where co-design and patients being part of it from inception to delivery is key, because ultimately service user satisfaction should just outcomes compared to OECD. It should actually be how.
But that's and access then is key, and I suppose what we've been pushing from Sinn Féin's perspective, but also, I mean, others we engage a lot, is how we can maximise the benefit of an island. How we can minimise the expense of running two healthcare systems on a small island. So, separate to the politics, my politics, but separate to that, it actually makes a lot of sense to be able to operate collectively in a small space. I mean, this island is not big. Running two health services is unnecessarily cumbersome. And when we see, today we signed the memorandum of understanding, that's brilliant. But when we see the fact that we should be acting collectively as an island, that is our best chance in terms of the virus, but also in terms of building a newer health system. We will get through this. That's what everybody says, and we know we will. We will get to the other side of this, and the hope is that the lessons that we will learn on the far side will be not just around having a concert for our healthcare workers, or giving them all a pat on the back or anything like that. Decent pay and conditions. I mean, as I used to say when I was a union official, nothing says I love and appreciate you more than decent terms and conditions of employment, proper pay, proper equipment, and ensuring that our healthcare workers have that as a given, that it's not a battle. Because I mean, most of the time when I talk to healthcare workers, they're either just about to head into a row, or they're preparing for a row, because they know, and they're not battling for themselves, they're battling for the health service and on behalf of the patients. And I think, as a country, we've sort of stood back and gone, my God, aren't we blessed with our healthcare workers? But the end of that sentence is, and now it is time to ensure that it's not just when there's an emergency and they're all decked out in their masks and their PPE that we just go, my God, you're amazing, you're heroes. But that we say, do you know what we're going to do? We're going to pay you right. We're going to give you the tools for the job, and we're going to ensure that we have, the foundation to build. Because without our healthcare workers, we just have a whole load of buildings with equipment in them and no actual healthcare being delivered.
Like at the moment, like what I'm hearing from my colleagues in the front line is people just want to know that the PPE is there so that we can do our jobs with the minimum risk to ourselves and our families and our patients. But after this, if I look at my consultant colleagues, like we went into this with the lowest consultant numbers in Europe. That makes us more vulnerable because our rosters are tighter. And so, when this is over, be addressed. And another thing, Louise, that really has to be addressed, and we were pushing at the last government to do it, was the Medical Practitioners Act. It has to be revised. Like the current system is racist towards doctors who have trained in other countries. And I feel really strongly that when doctors come here and they're providing service, coronavirus isn't to what it is the doctors who were born here or who trained here. And so if people come here and they're working here, providing key service that's really needed, they should have the same access to training as long as they're meeting the same standards as the rest of us. And so the council, the IHCA, the IMO, we've all been calling for this, and it wasn't addressed. It needs to be addressed.
It does. It does. And I mean, that we had hoped, to be able to do more work on that, and we will continue to do our work on that. Now, unfortunately, that is all that we have time for. And as ever, when I am talking to Gabreille, the time is after going like that. It has just flown. I want to thank everyone for sending in your questions and your comments. We weren't able to get to all of them, but we do have someone who will be trying to get back to as many people as we possibly can. But I want to say that we have had a huge volume of texts and messages. So be patient with us, but we'll do our very best. We really, really value the input of every person, not just the people who are watching and commenting, but the people who've engaged with us in the run up to this. I want to say, obviously, a special thanks to Dr. Gabreille Colleran, because as you can see, she is a very, very busy woman. She took time out for us this evening, and I really want to sincerely thank her for allowing us to have an insight into her life and the preparations for this. These are really, really tough times, and what we need to do is we need to say thank you, and we need to salute those people who are getting us, who are out there on the front line of our healthcare, absolutely, but also the people who are working in supply chains, the people who are working in retail, the men and women who are making sure that our utilities keep working all the way through this pandemic. And, those people, public transport workers, those people who are out there making sure that everything functions. For us, for the rest of us, we have a really simple job. All we have to do, stay at home, wash our hands, and observe the social distancing, so we can all do our part to make sure that we make your job that bit easier. But no matter what, we know that you're in for a tough couple of weeks, and we absolutely salute you, and we'll be here on the far side of this to work with you to make sure that we learn all those lessons. So thank you very much, Gabreille.
Louise, could I just make one last plea, which is, we're coming into a bank holiday weekend and there's going to be good weather. And I know it's really hard for people to stay at home, and it's especially hard if you've got small kids and you don't have a back garden, and there's loads of things that make it harder. And, people are doing their best, and, lots of people have a lot going on, even without this. But the effort people are making now is making a difference. We really need that to go on through the month of April. So please work with us. And it really is about us making it possible so that anybody who needs to come to will have a bed, and that we will have staff to look after them and a ventilator. So everything people are doing, it is going to make a difference to someone you love. So please keep doing it. And thanks again, Louise, for having me and having the opportunity to talk to you tonight.
Good to talk to you.